My name is Bezela Ferdawek and I work in CCRDA as the Ethiopian Civil Society Health Forum. As you know, in CCRDA we have 7 thematic forums, and among the 7 thematic forums, the Ethiopian Civil Society Health Forum is one, which mainly work on health sector. So I work in coordinating this health forum. The Ethiopian Civil Society Health Forum was established in 2012 by 12 interested NGOs, both national and international, by mainly the support they get from CCRDA. When the forum was established, the main vision was to create a conducive, very good environment for civil society organization working on health to collaborate together and work toward the health sector transformation plan of the country. We have health sector transformation plan 2 currently, so we have updated our vision. And at the beginning, as I said, the 12 members established the forum, and currently we have around 160 legally registered member organizations. In addition to that, the Ethiopian Civil Society Health Forum have currently 8 actively functioning working groups. To mention their names, we have RH working groups, which mainly engage civil society organization working on RH. We have TB working groups, which brings together organization working on TB prevention and control. We have immunization working group. We have healthcare financing working group. We have meal working group, and so on. So we classify our organization based on their thematic area so that they can actively engage and contribute to themselves at the same time to the country. When we see the leadership of the Ethiopian Civil Society Health Forum, we have a General Assembly which consists of the 160 legally registered members, and again we have a steering committee which are endorsed by the General Assembly, and we have 9 steering committee members elected by the JA. And again, the 8 working group have their own chairperson, vice chair, and secretary. Even if they have their own term of reference. In addition to that, the forum have its own bylaw endorsed by the General Assembly. To engage our members more, as I said earlier, we have working groups based on their thematic area. So organizations select their thematic area and engage in that working group. And every working group have their own leadership. They have their own term of references. We have a Telegram group in which we update each other when we have new workshops, trainings, or new informations for each other. And we do different workshops, training on regular basis by mobilizing resource from donors. So members engage this way. By the way, we also have a 5-year strategic plan besides our directory. In addition, we revise our directory every 5 years. And in that directory, we can see list of the 160 legal registered NGOs, which thematic area they are working, the date of their establishment, and working group they selected. So whenever any organization wants to know its member, we provide the directory. And they used to update themselves, to know each other, to share experience, and so on. Since establishment, the Health Forum have done many important achievements toward the health sector transformation plan, especially in hard-to-reach areas such as in Afar, Gambela, and in Benishangul Gumuz. Before a couple of years, we have done bigger advocacy with regards to immunization in Gambela and Benishangul Gumuz, and as a result of the movement, dropout rates were decreased. We do different campaigns besides, such as the African Vaccination Weeks. In these events, we try to trace out dropouts for immunization and help them to get immunized and increase the immunization rate of that region. And at current stage, we do a project with Save the Children and Bill Gates' Anchor 4 project, which mainly address RMNSH, nutrition, and pneumonia in our country. So we have been advocating RMNSH issue, especially with healthcare financing, since 2017. Through the support we get from the Save the Children and Bill Gates. So as a result of this project, we have tried to increase the allocation of budget for Afar region to 7%. So currently the government allocates 7% increased budget for the health sector in Afar region as a result of the lobbying and advocacy of the health forum. So in addition to this, we do different sensitization workshops, assessments, especially now after COVID-19 situation. We have tried to do assessments, research on primary healthcare service. Now we have already finished the assessment, and we have presented that assessment to our member organizations. So based on that assessment, we are helping organizations to advocate on strengthening primary healthcare service during COVID-19 situation. Because as we know, the COVID-19 situation is affecting our health system. So as a CSO, we need to advocate and strengthen our health system. So we are also working on that. With regards to the decision making, as I said earlier, we have a steering committee. They are elected by the members. So whenever we need any decision-related issue, we communicate the steering committee. The steering committee also have a regular meeting every month. They meet every month. So we discuss the day-to-day performance of the forum to them. We present the reports, we present the plan. We also gather together with the steering committee and with the working group leaders to plan every year. We plan together with them. They follow through the steering committee. So the main decision-making role goes to the steering committee of the forum, besides CCRDA. Yeah. We have a resource mobilization working group. So any interested organization who wants to mobilize resource for the forum and the working group can join this working group and collaborate in concept notes. Currently, we are preparing different proposals and concept notes and submitting to donors. For example, in the recent weeks, we have submitted a proposal to USAID on health system improvement, in developing capacity building materials for CSOs. So we have also collaboration with Anti-Malaria Consortium, and we have submitted a global fund call. So we do different such kind of activities. Yeah. Currently, our main work as the Ethiopian Civil Society Health Forum is advocacy. And we have a project related with RMSH, nutrition and pneumonia related advocacy work. So we integrate advocacy in all the activities. Like we do evidence-based advocacy. We do researches, we do assessments first, then we implement according to that to make a evidence-based advocacy. So it's our main area for work. For example, we have advocated the HPV-2 vaccine and MPV-2 vaccine. Exactly. There is a new launched measles 2 vaccine and human papillomavirus vaccine for the community. So we advocate using medias. We engage the media, we do TV panel discussions, radio panel discussions. We send text message to our member partners. We do TV spots in different language, such as in Afar, Somalia. So we use the media as an advocacy tool, and we advocate.